here with the executive director of NAMI Tennessee, Jeff Fladen, and we're here to talk about the mental health year in review. But before we get to that,
Woohoo!
it's uber important, one, that you have a very happy holiday season. Two, since this is our last one for 2020, Happy New Year. May 2021 be better. And three, head over to NAMITN.org and sign up for our email list. They come out weekly and they curate lots of great content. And you also find out about great Facebook Lives like these. So remember, it's NAMITN.org. Sign up for our email list. And hey, while you're on the page, check out some very, very cool resources. Jeff, are you ready to get started?
I am ready.
All right, teach us everything that we need to know about mental health in 2020.
Well, do we still have mental health in 2020? So if you followed NAMI Tennessee, I've been doing radio and we switched to Facebook Live, but a staple of every year, so I don't have to ask a guest to trudge up to the radio station right before Christmas, I've done a year-end show. And then we start January with the look ahead, which hopefully will be rosier. But looking back to 2020, where do you start? You start remotely. So you and I have had a lot of conversations remotely. I haven't seen you in person for over a year.
It has. It's been there's the last holiday season, right?
There you go. But somehow I feel we've grown closer.
Yeah, because we've had Zoom. I mean, we are talking more. We are less busy. It is true that we haven't been in the same room, but we've had more free time because we're on less planes. But the biggest thing that Zoom brought along, I think, and probably I think it's the biggest thing for 2020. I'm interested to hear your thoughts, is telehealth. It was always around, but now it's around.
Well, telehealth is such an obvious change in opening up psychotherapy for people that didn't want to or couldn't get to an office. But let's talk about society first, since we talk about remote. To me, the biggest story for 2020 with mental health is it's an issue for everybody. When before it was an issue for people that have a mental health condition, or they're a loved one, or they're an advocate, or they're a law enforcement officer, but now it's an issue for everybody. And there's been so many articles in every news source, New York Times and BBC and NPR and Guardian and everything about this impact on kids, on families, around life cycle issues, birth, grief, death, marriage, ability to socialize, to have support, isolation. To me, the big story for 2020 is that mental health is for everybody.
It is interesting that people who thought that, mental health, that was something for other people, as you put it. It wasn't for everybody. Mental health issues were something that other people had. Suddenly, more and more people are like, Gabe, I think I have anxiety. I was like, well, why do you think that? They would explain the symptoms perfectly, and I would ask them, well, what can we really expect? I mean, anxiety, depression, hopelessness, loneliness, isolation, these are all part and parcel of being involved in something as massive as a global pandemic on a scale that we haven't seen in 102 years. So I completely agree with your assessment that maybe a silver lining is that more and more people are coming to the party that everybody has mental health, albeit most people most of the time have good mental health.
I would even carry it a step further. Is mental illness really an illness after all? Or is it a natural reaction to life? And when we have these reactions, we're a chemistry set. We operate on brain neurochemistry and endorphins and whatever else is in the body, acetylcholine, whatever.
Bunch of doctor
So
words.
yeah, so the environment impacts us as a human animal, and maybe everybody is having anxiety and depression somewhere. We have other diagnoses too. It's not just anxiety and depression, but that's been the one in the news really, really big. So maybe mental health is the right word, and a mental health condition is the right word. Now, the NAMI people, I'm one of them, might not like this because mental illness is in the name, National Alliance on Mental Illness.
I think that one of the things that I don't think that we've ever done a very good job of understanding as a society is that everyone has mental health, but not everyone has mental illness. Let's get away from mental health and mental illness for a moment and talk about physical health. Everybody has physical health, but that doesn't mean that everybody has terminal cancer. It doesn't mean that everybody's broken a bone. But a physical health issue is anything from a headache to diabetes to a broken bone to a terminal illness. And it all exists on the same spectrum. Tying that back to mental health.
But let me stick with physical health first.
Yeah,
I would
please.
not agree. I've heard you say this before, everybody has physical health. That's like saying everybody has height or weight. I would say there's a continuum where we can measure health status, large impairment, less impairment, mental health too.
But there's
We
also
could
no
have
impairment, right? That's the
zero
spectrum.
symptoms to every symptom you could have,
Right.
and we're a different place on that line. A few symptoms, a lot of symptoms, and we talk about getting counseling or getting help when symptoms really interfere with your life. So
Right.
I don't know if what that means about an illness or not, but we know that depression can get worse if you feel like not doing anything, not enjoying anything, and not getting out of bed, and you have all of a sudden no food, no clean clothes, and the power got turned off because you didn't pay your electric bill. You might be feeling worse.
I it's a fascinating thing to consider that, like, when it comes to mental health, people, they really feel that it doesn't impact them in any way. And I always push back hard against that for two reasons. One, as I said, I believe that everybody is on the mental health spectrum. Most people, most of the time, have good mental health. That is where emotions like happiness and joy and pride exist. But even moving that aside, mental health doesn't impact me. What if your loved one is having a mental health issue? What if your friend is having a mental health issue? But let's forget about that moment for a moment. What if your boss is having a mental health issue? Like, these are things that will impact you. The person that you see when you go get your cup of coffee is having a mental health issue. I,
Gabe,
I
would you say that yelling and screaming at people a lot would be related to a mental health issue when you
it
talk
could
about a
be.
boss, let's say?
Sure. Yeah, that would be anger, right? Or
So anger
potentially
is an
rage.
emotion, but lots of anger, inappropriate anger, we might see as a symptom of certain mental illnesses.
Yeah.
Anyhow, I don't want to belabor the point too much. To me, the big thing for 2020 is that mental health is for everybody, and we're all talking about it. And we know that anxiety and depression are getting much more common according to every report. And also, other things are looking like they're getting more common, like overdose rates. And it seemed like we were making some progress with getting ahead on opiate addiction and more treatment, and that we're losing some of the progress. So to me, number one for 2020 for me is that mental health is for everybody, and I really mean it this time.
I I love the fact that more people are talking about it. That really has been a silver lining. I was diagnosed with bipolar disorder in 2003. I became a mental health advocate. about 4 or 5 years later. So I've been around for a long time, and I can say that in the last decade, in the last 12, 15 years, this is the most that I have seen and heard people talking about mental health issues, et cetera. Most of the time, it's just relegated to, I don't deal with that. And now I'm seeing all walks of life, all generations, all genders really saying there's something here. And I think that's
Greater
amazing.
concern and children, and if they don't get to play with their friends, what's that going to do to their ability to form relationships? And is Zoom going to actually be a reasonable replacement? I'm not sure until we all put on the ocular rift and we feel we're in the room. I think we're missing, even though this is a lot better communication than text, I think, to convey emotion,
Yeah.
although we have emojis with text. But anyhow, my number one is mental health is an issue for everybody. What is your biggest number one happening related to mental health in 2020?
Yeah, as we talked about a little bit in the beginning, it really is telehealth. And I think that it's telehealth for a few reasons. But the biggest one is because I hated it, Jeff. I cannot be more clear that last year at this time, if you would have asked me about telehealth, I would have said, look, maybe if you're on the low end of the spectrum, maybe if your symptoms are small, or if you're managing something small. And I don't mean that. I know that just because it's small in the grand scheme doesn't mean that it's not big to you. But when I think of major depression, bipolar disorder, panic attacks, schizophrenia, telehealth does not, it rang hollow for me. Now I live with bipolar disorder, and because of everything going on with COVID, I had to do telehealth. It was my only option, literally my only option. And I'm not going to go without treatment or medication. So reluctantly, Jeff, I was forced to have a telehealth appointment with my psychiatrist. It was amazing. I loved almost every part of it. I even got more time with my doctor because there was just more time available, because it's just a much more efficient process as far as getting people in and getting the information down. And I felt that I got a very high quality of care. Now, I don't want to see Gabe 100% on telehealth, but I definitely see for the future seeing, maybe every other one, once in person, once telehealth. And that's a big deal. But then I also saw just the everywhere that it can go. I live in a big city, but what about rural areas? What about people who only have one psychiatrist in their in their area, and that person doesn't specialize in what they have? Well, now they can not have to drive to a big city, or if they're not able to drive to a big city, they have more options.
Yeah, I
It's
think there's
exciting.
some real advantages to telehealth. And to me, I've had doctor's appointments with telehealth, and I mean, it's new and different, but I feel they're there for me and they care during that time. So the big problem, of course, is if you don't have access to broadband, to Zoom, if you don't have a computer or a smartphone, it's cut off. And I think we have to do something about that. But let me tell you something, Gabe. There's a lot of people don't want to sit in that doctor's office and worry about who's going to see them in the
Right.
mental health counselor's office, particularly if you're in a small town, and who's going to see you there. That can feel a little bit awkward. I mean, do they have one door in and one door out, and waiting rooms? I mean, these are barriers to treatment. There's still shame and stigma, sadly, around mental health counseling, mental health treatment. So there's that. But the other part is, if you live in a small community, and look at our election, how can we not mention that when we talk
Yeah.
about mental health as a stressor? Up in the air, angry, uncertain, whatever you say about who you like or don't like. But we have a lot of people that are not in cities in this country. And if you're not in a city, do you think there's a therapist that understands veterans and addiction and depression in your town? Do you want to have to travel an hour and a half I grew up in a small town in Ohio, an hour from Columbus. Did I want to come into the big city where I don't know how to park and there's a lot of cars?
Right.
Uh, at least now we have, uh, Google Maps or whatever, ways. But without leaving your home, you can have a therapist or a doctor's appointment or a nurse practitioner. Well, what if you're a single mother with little kids? I mean, maybe you can put on a movie and hopefully they won't say mommy for an hour, maybe. But if you're on your own and you don't have somebody to watch the children and get out, or what if you don't have a car
Right.
and you're going to hop on a bus and in the winter or during COVID? So it opens up the possibility to be seen. And the second thing is it can cut the cost. If you don't have to have an office,
Yeah.
if you can work from home and cut the cost, maybe there'll be more therapy capacity. And maybe we can learn something through data that comes along with some of these systems of symptom checklists and what helped and what didn't help. I hope there's some research going on about outcomes with psychotherapy and prescribing with telemedicine. It would be, easier, I think, to gather data and learn more about what really works, which we think we know that connecting with a therapist is what works more than what the approach is. If you feel listened to, if you feel they care about you. But anyhow, I agree with you. Telemedicine is a biggie. That's just a big, giant one. Can I tell you the one that I think fizzled?
What I'm surprised to hear that anything fizzled in 2020 except for our social lives. Yeah,
Well,
what
if
was
this
the
didn't fizzle, then I'm not as plugged into the news as I think that I am. And what fizzled is ketamine, in my opinion. So ketamine was used through a thing called infusions, which is an injection for serious depression. And some people thought it was really, really great. And then about 2 years ago, there was a nasal version of ketamine. So it didn't require these expensive, non insurance covered, out of reach for most people infusions to now it's a nasal spray. Have you heard any big reaction that people like it, don't like it? Is it helping? What the heck is happening with the ketamine?
so there's a one I want to preface this by saying that I don't 100% know because like you said it fizzled. People just stopped writing about it. As sure as we're sitting here, Jeff, there is somebody who is using it as their primary treatment. It is a lifesaver for them, but it was everywhere. Back in 2019, you couldn't pull up a mental health podcast or article or website and look on the front page without seeing it. Just it was the wonder drug that was going to save us all, and now it's on page 5 of Google. It is still out there, it is still a treatment, but I think that some of the things that I think that some of the reasons that it went away is, or not went away, but it has been relegated, is because of the way that it's administered. Because ketamine was derived from a party drug, they put a lot of restrictions on how it's prescribed, et cetera.
Well, actually, it wasn't a party drug. It was used in surgery. It was a short acting analgesic, but it was abused as a party drug. Yes.
Exactly. Yes. So there was a lot of unfair, depending on how you look at it, unfair regulation on it because we were afraid, we being society was afraid of the abuse. So in order to be prescribed this, you had to go and get it. Well, in 2020, you don't want to go and sit in a room with anybody.
Well, but again, it was not just that. I mean, it had to be IV. So you
Yes.
weren't going to do it at home. This infusion
No.
was an IV, expensive. I don't know how much insurance covered it, but it's the nasal that I wonder about because that's you get that from a pharmacy, maybe. I'm not sure. So it kind of fizzled. I don't know that we won't hear about it coming back, but that fizzled. And there's another one I think fizzled, and that is genetic testing for medication.
So that one, I think it's along the same lines. I believe very strongly that genetic testing for medication it's gonna come back into the news. I think that's telehealth, right? You can't get that swab because you're not there, and apparently there's no home kit yet. So perhaps with telehealth, they'll invent a home kit where they mail it to you, you swab yourself, put it in the thing, and mail it back. Before, this was always done by the person who took your blood pressure or blood work. It's so I think that's still out there, but because people with mental illness and mental health issues are using more telehealth, we're not getting that swab because we're not in the office.
Well, when I
That's
say
my gut.
fizzled, I just mean it didn't get big this year. And maybe we can put that on our list for what's coming in 2021. And I've got one more. I hate to be in such a downer, but the other thing I think is fizzled is new meds.
Oh well,
Uh,
new meds didn't fizzle. It's fizzled for years. I I hang on. Let me find my soapbox, Jeff. It's around here somewhere. I don't think people are aware that the biggest advancements in psychiatric medications in the last decade have been serendipitous. They've been accidental. They weren't researching, depression, anxiety. They weren't researching psychiatry. They were researching something else. And during the testing phase, they were like, oh, it doesn't do X, but it
it
does
helped.
seem to make people feel better. So then they
Yeah.
started testing that, and then small tweaks, and boom. It's the exact same way that we came up with Viagra. They weren't testing an erectile dysfunction medication. They were testing a different medication, but they noticed that everybody that they gave it to reported that they were no longer having ED symptoms. So they switched up the research, they found it, and boom, this led to a breakthrough. Now that's wonderful, except that you have to ask yourself, if you're living with serious and persistent mental illness, how many people are actually looking purposefully for a cure for us? And the answer is not as many as you think.
Well, we've heard about Operation Warp Speed and all these companies working on the vaccine, and thank God, and that it could be certainly a game changer for COVID. However, where is the research for new meds? Because Gabe, you know the answer to this. Why do most people not want meds?
The side effects are
Side
horrific.
effects.
Yeah,
Or maybe it didn't help.
yeah, side effects is number one. Misunderstanding of how it works, which I believe is reported by my community as it didn't work. I think it didn't work is actually the misunderstanding of they didn't understand how it worked. A lot of people really believe, and by a lot of people, I mean both people living with mental illness, their caregivers, their family, their friends, and society at large, believe that psychiatric medications work like aspirin for a headache, that you have the headache, you take the aspirin, the headache goes away. So you have bipolar, you take the medication, the bipolar goes away. And that's not how any of this works, but this myth persists. So I think people are prescribed medication, they take it for a couple of weeks, it doesn't work miraculously or in the way that they believe that it should, they stop taking it and they declare it didn't work. There's not a lot of
Gabe, I
education
think
about
you're
this.
right on there. However, I'm wearing a hat and you're not wearing your advocacy hat right now. You got
Uh-oh.
headphones on. But the advocates, I think, need to continue the pressure and increase the pressure. New research for new meds, just research on dealing with these symptoms, because again, we started with anxiety and depression, but then we can talk about serious mental illness. Some of these conditions are, and in death, in all kind of horrible disability.
Yeah.
We need to up the pressure for new and better meds. And it's not just the person taking the meds fault that they wanted a quick fix. Sometimes the weight gain, the other symptoms, people go off the meds, they're back in crisis, they're back in the hospital. We need better tolerated meds, and we need more meds that are more effective more often. A lot of meds really help people, and you would agree with this. Psychiatry is an art, not a science. And many people are tried on different meds and different combinations till they find what works for them. And what works for them may not work for somebody else, but the advocates need to up the pressure for better meds. Do you agree?
I completely agree. Education is, of course, very, very important so people know what they're getting into. But the fact that we can't resolve some of these issues, like the massive weight gain or the sexual side effects, it is, I say often that it's understandable, right? You have a mental health condition and it's causing you great pain, and you take this medication and suddenly you gain 20, 30, 40% of your body weight, and these are not exaggerated numbers for some people. Or the sexual side effects, kill your libido and your ability to be sexually active instantly in a population that's commonly diagnosed between the ages of 16 and 24. These are huge issues, and by and large, the medical community seems to respond to that by saying, well, I mean, you've got bigger fish to fry than your weight. Well, I mean, isn't it worth it? You're no longer fill in the blank. And I think that's sort of a disingenuous thing to say to somebody who is sick when they're trading one illness for another. I don't think you should pat yourself on the back for solving one problem while creating another. I think this is where, like you said, Jeff, more research needs to come in, more understanding. But more than anything else, it really is difficult for people with mental illness to be told that it's okay that we've gained so much weight. It's not okay, or that it's somehow okay that we're having a sexual side effect or any
No,
of the
we're
other side
understanding
effects.
people are
It's
not
not
living as
okay.
long, that have
Yeah.
serious mental illness. It could shorten life. But so, do you have any other non-trends that didn't happen in 2020?
There's obviously the trends. I was really looking forward to support groups growing in person in rural areas, and actually let me expand that out. Support groups meaning I should encompass drop-in centers. We were drop-in centers and clubhouses. That model has been they've been in big cities for a long, long time. We were starting to see them in the last 5 or 6 years spread into rural areas. Now, whether they were in recreation center basements or church basements or the back rooms of businesses, I don't care. We were starting to really embrace in-person peer support with drop-in centers, the clubhouse model. And because we can't meet in person, that expansion has stopped in smaller towns in the rural areas. That said, I do believe that we will get back on track as soon as the pandemic passes. But as somebody who really loves peer support, Jeff, and you know how much I really love peer support, it was kind of a bummer to see that pausing of that movement.
Now, I want to react to that because I think that the recognition of the importance of peer involvement has grown in 2020. And I would say that is one of the good positive elements. Now, doing it in person at a clubhouse or walk-in center is a challenge. And some walk-in centers or some peer centers have tried to move to virtual as much as they can. But the idea on the part of policymakers and program managers that a person with that lived experience, that they've been there, that they have something to add, and it's a legitimate part of treatment and moving toward recovery, I think that's grown this year.
I agree. Seeing it move online has been exciting. It has been exciting, and maybe this is left over of the part where Gabe struggles with telehealth. I know that for me, being around people like myself with serious and persistent mental illness, bipolar disorder, major depression, schizophrenia, psychosis, being in the room with them, feeling their energy and holding their hands, getting a hug, whatever it was, even just sharing a cup of coffee or a cupcake, these were so important in my early recovery. And also almost equally important was getting out of my house. my house represented a lot of wallowing, a lot of depression, a lot of alone and lonely and isolation. And going to those support groups meant, even if nothing else, I wasn't at home and I was forced to take a shower. And I don't think people put enough stock into having that thing to look forward to outside of your house is important. Now, again, I want to be clear. I understand why it's paused. I am in agreement with it. I just think that it's going to be very exciting and very hopeful when we can get back to it, because it was just so incredibly helpful to me and a lot of people that I know.
Mhm. What are some of your other highlights of 2020 mental health?
Yeah, so I know this is going to sound hilarious coming on the heels of what I just said, but online support groups are amazing.
Well,
I
NAMI Tennessee does them, and if you go to our webpage, namitn.org, you can find online support groups. And what's nice about that is if it's only once a month, you can go to the other support group from the other NAMI affiliate that's the next week. You don't have to wait. There's more choices. Aren't there more choices?
Oh, there's so many more choices. The reality is that not everybody feels the way I do about online learning or about online support groups, and that's so reasonable and acceptable. And I felt for a while that NAMI, you've got family to family, you've got peer to peer, you've got these educational classes, and I was like, why is there not a push to move them online? And then even outside of NAMI, let's talk about like mental health first aid. Mental health first aid is an incredible program that helps people know what to look for to prevent suicide in their lives. And then they have one for children, like for teachers, et cetera. Now, teachers are a really busy group. So being able to offer them online a year ago, they're like, no, this is an in-person thing. This is an in-person thing. A year later, you can take all those classes online. And we're seeing more people, now the mental health first aid classes, we're seeing more people sign up for them. I think that is absolutely incredible, because the reality is that some of these programs, they just aren't, there's not the ability to do them in every town or in every city or in every area. And also, as you've pointed out before, Jeff, maybe you don't want to take family to family in your neighborhood because you're not there yet, because you're still embarrassed, or maybe there's a rift in the family where one parent wants to take it and the other parent is still in denial, and now you can take it online privately and not have to worry about all of the the things that we hear from families. And that's part of meeting people where they are. And now all of a sudden, some family members can take it right online with people who are in other towns, so they're maintaining a sense of anonymity, and that moves the bar closer to them getting on board, becoming an advocate, and supporting themselves and their loved ones. And I it's exciting. It's exciting.
I'm
More
thinking
is better.
about another happening, I think, and that is the growth of the co-responder model for a mental health crisis. So you and I have both been involved with CIT, and you're still involved with CIT, but the co-responder models have to do with maybe a blend with law enforcement and mental health, as opposed to law enforcement being always the first on the scene for a mental health crisis. So there's different models, and one, Cahoots, has been in the news, which isn't really maybe technically a co-response model, because that's an EMT and a mental health worker, and law enforcement's not even out there at all after triage, which that's maybe, some might say that's a more extreme shift, because sometimes there's weapons involved and dangerousness. But the idea of a social worker riding along with law enforcement would be at one end, the Cahoots model maybe at the other end. In Memphis, there's a new model where it's EMT, I think, again, and a mental health worker with backup from law enforcement. So have you been exposed to co-response?
Yeah, Columbus, Central Ohio, where I'm from, just got it in the last year or so, and it's been amazing because we have a team where a police officer and a social worker essentially become partners and travel around together. And this has just been incredible. Now it's there's not enough of them. They're not 24 hours, 7 days a week. There's much work to be done. But 2 years ago at this time, social workers were not part of this process. Mental health workers were not part of this process. Police officers were trained, but they were still left to resolve these issues on their own. That's very exciting for me for just a number of reasons. But it is proving to have better outcomes. It's getting more police officers to witness that de-escalation techniques can work. It's also allowing social workers, and I think this is a vital point that never gets talked about. It's allowing the mental health community to see what police officers and law enforcement are faced with. You know, it's really easy to sit in a room and say, well, why didn't they? And now that they're working together, both sides are seeing the benefits and the challenges of each other's job. And I think that is moving us closer to finally coming up with a system that will work in the long term and that we can model across the country. And who knows, maybe in 5, 10 years, we'll have as close to a resolution to this as we reasonably can.
Mhm. So what else, when you look back at 2020 related to mental health, like you've talked about serious mental illness, and I brought up just people with anxiety and depression that hadn't thought of themselves as having mental illness before. So, uh, are we paying attention to the most vulnerable during this pandemic?
I think in many ways we're not. I have heard of across the country numerous psychiatric wards being converted to COVID wards and to ICUs. On one hand, that does address the pandemic, right? It creates more space, more beds, more quarantine possibilities to save and help more people with COVID. But we already had a bed shortage. Like, but before this ever started, there wasn't enough beds for the psychiatric community, and now there's less. That's very concerning. As with anything, whenever you have more people who are having mental health crises, that means there's more people in the system. I don't think there's anybody within the sound of our voice, Jeff, that thought that the mental health safety net was fully funded, fully operational, and unstrained. So these conversations about how there's more people using it has to make people understand that if there's more people using an already strained system, who's probably going to get left out? And that's the person who can't advocate for themselves or doesn't have an advocate on their own. That is very scary and troublesome for me.
That probably happens a lot, but I'm going to give you another view. Um, it's easier to criticize the government than to praise the government, but I think our governments have surprisingly done a pretty good job stepping up. So I'll just kind of put it this way at its most simple. When money's tight, you might expect mental health to be cut first. And that's happened before, where when state funding was bad, states cut mental health. And in my state, I can't speak for Ohio, but I bet it's true in Ohio too, because you have Medicaid expansion. The government covers a lot of mental health costs for people with severe mental illness and addiction, and there's been more money, not less. And some of it's federal that came through the state with a thing called the CARES Act, and there's been provider money. And I've heard of almost no mental health providers going away. Can't say the same about restaurants where plenty of people with mental illness worked, but I think the government's done pretty good. And in my state, in Tennessee, making sure that there's the PPE equipment at the mental health centers and the crisis centers, and the hospitals, and there's been emergency funding and disaster funding. And I think there's been a real effort when it would have been easy to just focus more on other things. And somehow our leaders figured out early this matters and it's important. And I feel really great about that. And, NAMI, sometimes we point out what's missing. Like, I would like there to be walk in centers in every county in Tennessee
Me too.
where somebody with a mental health crisis can just walk in without an appointment. And we start there. And we have walk in centers and we have more, but it's not everywhere. But I do think that in 2020, our state stepped up and the federal government with some of this emergency money stepped up. Now it seems to be coming to an end, and it needs to, we'll talk when we get to 2021 if there's been a continuation. So I'm nervous that politics has interfered with continued aid to the economy, and that also includes nonprofits and employers and states and law enforcement and those things. So I think the government's till now, there's things I'm not happy with related to the government, but in this area, kudos.
It's always interesting to have conversations about the response across the nation, right? Because when it comes to mental health advocacy, because depending on your zip code, it determines the type of care you get, and that's so troublesome to me, because I think that everybody with well, any illness, but this is a mental health show. I think anybody with serious and persistent mental illness should get the exact same care no matter what state they live in, no matter what town they live in. And I know, I can already hear
It's not true for physical care,
it's
Gabe.
not, and
You have
it's
insurance and or not, and where do you live? And we talk about food
you're
deserts in
right.
some areas. You've also got expert treatment deserts.
It's it, it just pains me so much. And I know that on one hand, people are talking about mental health more, but I am not convinced, and I'm not seeing people talk about serious and persistent mental illness more. That almost seems less to me. Now, even if it's the exact same rate, that's just a push, right? Now, my hope as an advocate is that I can turn some of those, mental health issues conversations into serious and persistent mental illness conversations. Like we can grow up and rise through the ranks, but it it's tough because people like us, Jeff, we see it all now. It's like, give us all the money, help people, and then everybody can be well, and that's what we want. And people are like, well, that's not realistic. And I struggle with that because I'm like, I don't know. I look at other budgets in the federal government, and they're fully funded. There are things in the federal government that have plenty of money, and they don't have to hold a bake sale or a walk or a rally to help people. And then there's other areas where we're selling cupcakes so that we can have X. I I just
We
I
have a
think this is
slightly different
important.
view here
We do.
because I think that early symptoms of mental illness, to use those terms, depression and anxiety can turn into serious mental illness. Enough stress, along with isolation and alienation and poverty and lack of access, can take something not serious and become serious. So, depression can turn into thoughts of suicide. Um,
Yeah.
so, this brings me to my last point, and the rest will be yours, is recognition that poverty has an impact on well being. I think that's an outgrowth of the pandemic and 2020. And I believe there's a very strong association between poverty and mental health and substance abuse disorders. So the idea that poverty, you don't just punish people in poverty and expect that's going to fix the problem.
Right.
And I'm very concerned that, I mean, I keep reading a lot that People that are in a higher economic situation are doing better, and people in poverty, they're really being hurt a lot. And how about people that cleaned houses before COVID? Did they get any emergency payroll protection money? Probably not.
It really depends on where you live. Uh,
Well,
As
if
you
you
know,
worked on your own and you cut Gabe's grass, well, you came in and cleaned the house, and no one wants anybody to come in their house and clean it. Maybe not nobody, but
well, look at
very
office
few.
cleaners. There's no office garbage, trash. I mean, it's a
Well,
ripple effect, right? Everybody's working from home, so
well, the
nobody needs to
impact
clean the
on
office.
people at the lower end of the economic continuum, I think there's a disproportionate. Their mental illness and addiction is overrepresented in that population, and that population's being hurt more by the pandemic and having to work when they fear COVID, uh, all that. So I think this issue of poverty is an issue for all of us, and I think that we're going to learn more about that because of 2020. So that's my last takeaway for 2020.
Jeff, I really like what you said there. You know, one of the things that we've been seeing with the vaccine, just to kind of piggyback on what you said, you know, we've got the vaccine now, yay, and we're talking about who to administer it to, you know, because we can't give it to everybody at the same time. That's just logistics and math. We understand that. And one of the things that's been incredibly troublesome for me is it's like, okay, they're like, all right, we want to give it to healthcare workers first. All right, that makes sense. Then we want to give it to extraordinarily vulnerable people, people in the hospital, people in nursing homes, people over 70. All right, that checks off. And I'm like, okay, when are we going to give it to grocery store clerks? And they're like, what do you mean? That we're giving it to, they're not considered frontline workers in many states, even though, as you pointed out, if our grocery store clerks, if our people who worked at drugstores and all of this, we need a, think of the UPS driver, like, oh, stay home, it's safer, get all your stuff delivered by Amazon. That means all the Amazon people have to go to work. They're not on the front end list, even though they do not have the option to quarantine, or they will starve to death. And I thought that was kind of a bummer. You know, at the beginning of all of this, we called them all heroes and we had parties for them and balloons and, you know, but now here we are with something tangible to give them. You know, thank you, grocery store clerk, for working for the last 9 months with the public to make sure that we have food. We want to give you the vaccine. And the answer was, nah, they'll be fine. That's a bummer for me. It's a real big bummer for me. I don't know how you feel about it, but that's.
Well, I think you're right. I think that people that will have to have contact with others because of their job, and we've decided we do need to keep our economy because that has a lot of other bad problems if we don't. People that are needing to work and be around people, I would put them above others, absolutely. If I was asked, which I have not been.
Yeah, it's really weird that nobody's called us. I don't. I've been waiting on my phone to ring, Jeff, for the governor of Ohio to ask Gabe Howard's opinion. Has the governor of Tennessee, has he forgot to inquire about what Jeff wants? I don't
Well, I
understand.
do. I have had a chance to advocate that mental health workers are health workers, and that they should be right up there with health workers.
I completely agree with that. Jeff, 2020 has been incredibly interesting on so many levels. On a personal level, I as a public speaker, I never thought that I would do anything virtual. I never thought that I would give my keynote address virtually. I had been asked before and I'd always said no. I said it's the kind of thing that you do live. It's a keynote speech. I need a podium. I need the audience. I need the hotel dinner. And now I'm doing it. And you know, with varying success. I still don't know when to pause for laughter. But when in Rome, we've all had to adapt and we've all had to adjust. On one hand, I think that more information is out there than ever before. On the other hand, I think that information has always been out there, and yet we still have people who believe that the earth is flat. So it's it's a curious thing to decide what the new normal is going to look like, what we're going to keep, what we're going to go back to. I mean, Jeff, I do believe that in 2021, I will see you at a conference. And some people are like, oh yeah, Gabe, of course. Yeah, you'll see all your friends at conferences. Whereas other people are like, I don't think you'll see your friends at conferences until 2026. I don't know who's right. So that's probably my biggest takeaway from 2020 is just to drop the expectations, because I was really one of the people that believed that everything was going to be resolved in a couple of weeks. They shut down the restaurants just for 2 weeks. Outside dining only just for 2 weeks. Mask mandate just for 2 weeks. Curfew just for 2 weeks. Here we are at month 10, and there is still some small part of Gabe Howard's brain that honestly believes it's just 2 weeks.
That's
That
not
is the
so
kind of
bad.
thinking
I
I got
mean,
to get over.
in AA, they say one day at a time, because to think, well, this is my whole life, it's a little harder. But if you can think one more day, 2 more weeks, maybe it's a little easier to cope with a challenging time.
No doubt about it. Jeff,
Do you
where
have
do we
any
need?
other happenings from 2020 you want to bring up?
I mean, the podcast that I host sold to a giant company. So I'm hopeful that in 2021, mental health will get out in a way that it never has before. It's really, I was associated with Psych Central, which is no slouch in the mental health game, and then to be purchased by Red Ventures, which owns Healthline.com. For those that don't know, Healthline.com is bigger than WebMD. They're just massive, and over the first and second quarter of 2021, they're going to be putting their full weight behind the Psych Central podcast, which is a premier mental health podcast when Psych Central owned it, top 20, and now it's really going to be given the star treatment. This is exciting for me because accessibility really matters. And this podcast, it's free for anybody to listen. Of course, it's ad supported, but it's just experts talking to people. And it's exciting that we have reached the point where such a large multi-million-dollar organization sees the value in this type of product. I am excited personally to be involved in it, but as an advocate, I just never thought I'd see the day that something like this would go mainstream. And this is as close to mainstream as I think mental health programming is ever going to go. It's extraordinarily exciting, and I'm very hopeful for the future.
Well, I wish you success with that, and remember NAMI when you do all this mental health mainstream work, because what NAMI allows is that anybody that cares about mental health can be involved without going to college, getting a degree, making it your career. You don't need to be a full-time advocate like Gabe Howard, but you can run a support group or make a presentation or teach a class through some training. So we are a peer movement or a grassroots movement, and I think we'll be growing and changing during the pandemic as well. So I guess you've said that change is the word of the day.
Change is inevitable except from a vending machine.
So I appreciated all the work we've done together in 2020, and I look forward to starting 2021 with some of our wishes, hopes, and predictions for 2021, which you'll find on Mondays at, I put Central first, 2 Central, 3 Eastern, on the NAMI Tennessee Facebook page, and then replays are available.
24/7. Yeah.
Check us out. Have a happy, healthy holiday season.
Thank you, everybody. We will see you January 4th, right, Jeff? That's our, you and I
That's
are
the
back.
first Monday.
Yep. See you guys later. Wave.
Bye.